Okay, folks, this is I'm John Risby, the patent professor, and today is Friday, October 23rd, and we have the honor of having Dr. Harold Hess with us today. So he's going to tell us more about himself shortly. But first, what I want to make a quick announcement for next week, and that is, if you haven't been following, October 28th to the 30th is the largest inventor I guess, webinar, seminar. I mean, it's an unusual opportunity because of this pandemic. Instead of a live event, we're having it on Zoom. And we have the honor of having special guest Kevin Harrington, who's going to be the keynote presenter. If you don't know him, he's the original shark on Shark Tank. He's launched over 500 products, selling with sales of over $5 billion. We also have 8 or 9 other fascinating inventors that are going to present, including the inventor of the selfie stick, the inventor of a camera block, all kinds of inventors, and you can hear from their story. Speaking of stories, we're going to hear from Dr. Harold Hess today and how he got his start inventing. And he is the CEO and founder of Enduralock, a company devoted to developing fastening technologies that are vibration resistant. We have some slides he's going to go over as well. Interesting enough, Dr. Hess is also a neurosurgeon, or I would say first was a neurosurgeon prior to becoming an inventor. And that's what inspired his ideas. He's going to talk about that. That inspired his locking mechanism that today is expanded to aircraft, spacecraft, the oil and gas industry. And he holds over 60 patents. So without further delay, Dr. Hess, let's welcome you on board.
All right. Well, thank you very much, and welcome everybody that's online. As was just said, I am a neurosurgeon. I practiced for 30 years as a neurosurgeon, and focused primarily on the spine. And back in, I guess it was starting in 2006, I saw another spinal implant that at a trade show, and it kind of inspired me because that particular implant required that to put it in, you had to open the person's back. So in other words, cutting the muscles, exposing the spine to put it in. And I said, well, wait a second, what if we can do this percutaneously? Meaning through a tiny incision on the side and do muscle dilation, which is much less painful, and put the implant in under X-ray. So I worked on it, and it took a couple years, but we developed a product that we call the Minuteman, and it goes into the spine, it stabilizes the spine, delivers a bony fusion mass to create a fusion. And the difference is the treatment in the past for these types of conditions of degenerative disc disease would require removing bone, putting screws and rods in. You're looking at about a 3 to 4 hour operation. What this implant did, the last one I personally did before I retired, took me 12 minutes. Wow. So a dramatic increase in in the speed of getting the procedure done, and also a dramatic improvement in the recovery time. With a typical operation, you can be out for a few months. With the Minuteman, there are people going back to work the next day. So it's a dramatic improvement. But one of the things that came out with the Minuteman, or hurdles that we faced, was that FDA required that it survive 5 million cycles of compression and 5 million of torque without loosening. So originally we had like a lock washer type design to lock it into the spine. But unfortunately, one of the implants failed at 4.25 million cycles, meaning that it got loose. So I had to come up with a lock. And so I invented this locking technology. And it was actually a few months later that I looked at it one day and I said, wait a second, if I modify this a little bit it would have many industrial applications.
But completely separate from any medical purposes or uses. Let me share my screen real quick, and you may not understand the relevance of this slide, but I'll shortly explain it. Like you might think, okay, so what does Morgan Freeman possibly have to do with you and 60 patents and the technologies and everything else? Well, one thing that's fascinating that I didn't know is that he started his career having joined the Air Force to become a fighter pilot. And it wasn't until his 40s that Morgan Freeman decided to really start in acting. And it wasn't until he was 52 years old that Driving Miss Daisy took off, which was his first film that really did well. And here, this is where the similarities are just mind-blowing to me, because I'm often asked by inventors, when is it too late to become an inventor? Just like sometimes, people that are going for, to become an actor in Hollywood, there's like, at which point do you throw in the towel and say, you know what, acting's not for me, or it's too late for me to start in a new field? And especially with this pandemic, I'll tell you what's surprised me to no end is, and it surprised my wife, because she's thinking, how are you so busy and you do patent law? Aren't patents a luxury that people are putting on the back burner while they're focusing on, like food and their mortgage, and are they going to be employed? How are people still filing? And I said, I've been busier than ever before. And then I looked into what's happened in past recessions and pandemics, and the game of basketball was invented during a recession. Sir Isaac Newton came up with the law of gravity while he was stuck in quarantine and had tons of extra time. Shakespeare wrote King Lear while he was stuck in quarantine and had tons of extra time. The iPad was launched days after the September 11th attack, when the country was just fixated on the news and the world stopped. And so there's something, when you talk about a relocation of your medical practice, allowing you to have a little bit of freedom from the rat race, so to speak, of going, from one surgery or one medical procedure to the next, that is when this creativity kind of kicked in. So tell us a little bit about that. Ironically, I think you were 52 when you had your first idea.
I was in my 50s. Actually, what happened was I was in a very busy practice right outside New York City. Mm-hmm. And it was the type of practice that you were busy throughout the day, but you also were busy every second to third night in the emergency room, with traumas that would come in and then taking them to surgery and so forth. Well, what happened was I relocated my practice, and I'm now in the Kansas City area. And when I relocated, the practice that I joined did not cover an emergency room. So I no longer had the emergency room responsibilities. I gave up trauma and pretty much had an elective spine practice. That gave me an awful lot of time. And so when you have time, as you point out, you start thinking.
That's right.
And, and it was interesting. I mean, I went to this medical convention and I saw this implant that I said, that's, something I might like to try in my own practice. And I thought, this, probably would save a lot of time. And to be fair, I think that implant probably cut the surgery from 3 to 4 hours down to about an hour and a half. But I said, well, wait a second. What if I make some changes and so forth? Then why can't I make this into something that is percutaneous and make it open not only for surgeons to utilize, but also for interventional radiologists and pain physicians to put in? So you didn't have to be a surgeon necessarily to put this in. And so then, with the time I had, I eventually formed a company, partnered up with somebody, and we moved forward, hired an engineer, and everything else is history.
Yeah, it's funny. During this pandemic, I have a lot of inventors that I've spoken with. They're still working a 9-to-5 job, but they're doing it remotely, and it's not even necessarily freedom from the 9 to 5. but just not having somebody looking over your shoulder 8 hours a day, watching what you're doing, they have an opportunity to start giving thought to things, sometimes ideas that were from 2 or 3 years ago that they buried and just said, you know what, I'm going to attend to this when I have time. And then all of a sudden they find they have time. So
Exactly.
I have Jenny, our moderator, she's in the background, but if you can bring up the animations and showing some of Dr. Hess's ideas. And I'd like to maybe start with, is this the second? Yeah, the second one, the RadioLock fastener. So tell us about how this was inspired actually by your medical product for spines. And we can just run that in the background while we listen to
Right. Well, I mean, basically the spinal implant also had these two flats and had a washer that had the two flats to prevent rotation. On the spinal implant, the teeth were on the back end of the washer. Here, they're on the inner circumference. We have a spring designed with teeth at the base. So basically, the washer can't rotate because of the flats. So when the nut engages with the spring to the washer, it's locked. It is mechanically locked. It can't move. When a 6-point socket is applied, it flexes the arms inward, disengaging the teeth. So it's free spinning. It doesn't ratchet. So you can apply a certain clamping force or what's called preload very accurately. As soon as the socket is removed, it flexes outward, teeth engage, and you're locked. And this same socket for maintenance can be reapplied to remove the nut, perform whatever maintenance is required, and then reinstall the nut. It's interesting. You mentioned how do we get into things like, becoming an inventor. One hobby that I had for most of my adult life was I was a woodworker. So I built a number of pieces of furniture in my house. And as anybody listening who's a woodworker can imagine, you come into problems where you have to design a jig to do a certain job. Well, that designing of that jig is in effect inventorship. So it's basically the same thing when we had the Minuteman, and the lock washer failed. Well, I had to come up with something. I wasn't going to just let the project drop. So I came up with this locking mechanism, and the original mechanism was ratcheting. And when we first took it over to industry, it required specialized tooling. But you can imagine if a plane needs maintenance and it's somewhere else in the world, then it's not advantageous to start looking for a special tool to perform maintenance.
Right.
But then we spent a fair amount of time, meaning over a couple of years, to refine it into a product that we now have that just takes a 6-point socket to put it on or take it off.
Now, how did you, when you started approaching these different industries, was it an obstacle for you? I mean, I know obviously in spinal surgery, being a neurosurgeon was a benefit, but do you see that as possibly having you viewed as an outsider to that industry? Like, what is this neurosurgeon? Who does he think he is to try to tell us how to create parts for aircraft and military uses and oil and gas and all these different industries that are completely outside the scope of your specialized training?
Sure. Well, one thing you might notice when you look at my website, you'll see that I list my title as Dr. Harold Hess. I don't say Harold Hess, MD. So a lot of engineers that I deal with, when they initially look at my name, they just think I'm a PhD, probably in engineering. I'll tell you a funny story. When we had our first exhibition at a trade show for Enduralock, it was in Seattle. It was a every other year aerospace expo, and so I always bring an engineer, but it so happened that at a particular moment the engineer was off looking at other exhibits, so I was there by myself, and I had a senior Boeing engineer come by. And he looks at the product. He was skeptical at first when he looked at the background, what we had written and so forth. They started playing with it. And it was almost like the light bulb went off. And he looks at me and he says, boy, I can get a really accurate preload. And I just nodded. And I had honestly no idea what he was talking about as far as preload. So when he wandered off, obviously I go on my phone, I Google, preload, whatever, and I realized, it's all it is a different way of saying clamping force. So when the next engineer came by, I said, you know what, you can get a really accurate preload with this. And, you start learning the lingo, and, it's almost like, I guess what I like to give the analogy is I'm like a TV engineer. I know enough that I can answer about 90% of the questions that are typically asked,
Right.
but I'm not really an engineer. And so, I have other engineers on the payroll, so they help out.
Right. It sounds like I'm not a doctor, but I play one on TV. You are a doctor, but you get rid of the MD. I love that. That's
Right.
because there's so many clients of mine that have found their credentials. Sometimes it's lack of credentials that are holding them back, but other times it's having really specialized knowledge in one field has people pigeonholing you into that field, and say, okay, that's great, stick to spinal
Right.
surgery type ideas, but leave the aircraft and oil and gas and all this other fastener type technologies to us engineers. But just by its very nature, inventors are inventing outside sometimes there is no field. There were no courses for social media when Mark Zuckerberg came up with Facebook. There was no. The Wright brothers were bicycle mechanics. I mean, they didn't have. Forget about an undergraduate in a certain field. Neither one of whom even went to college. I mean, only one was a high school graduate. So that's just the nature of innovation. Sometimes it takes somebody from outside the industry to really realize that there's a better way. I know, both of us are old enough to remember the old soda can tops that had that little metal tin piece that you would have to separate. And I'm going to do a quick drawing real quick, and it was, so you would separate this and you would have this little tab. And if you can see that, when I was in grade school, we would be asked to bring a bunch of them in, and it would be like tinsel for Christmas trees, and you would go around the tree with that. Of course, people were not as safety conscious back then, no sharp blades, and there were but there are huge disadvantages to this. I mean, first of all, it was filling up landfills. People were throwing them away at beaches. Toddlers were swallowing it. At the beach, on the sand, people were getting their feet cut. And it was an inventor in his 80s, not part of the beverage container industry at all, who said, you know what, why do we have to have this piece separate? Why can't it just be something a tab that you push down? And I'm glad he didn't say, who am I to change the beverage industry forever with this idea, having never worked in that industry. Sometimes it takes someone from the outside to really realize that hey, there's something to be said for this idea, and there's something sometimes a change for an industry comes from the outside, because everyone in the industry just assumes that the way it's done is just the way that it always has to be done.
And a lot of times it's just realizing like for example, with me, it was just originally a solution for the problem that I had with the Minuteman. But then it's taking that next step when you realize, okay, what is just an ordinary solution for one industry, all of a sudden can become something disruptive in a different industry. And that's where I think we are right now with Enduralock. I mean, to give you an example, in aerospace for a self-locking nut, the requirement is to withstand 30,000 cycles of vibration. That's a standard throughout the aerospace industry. With the technology that we developed, we were able to test in an independent lab up to 300,000. So in other words, 10 times the aerospace requirement. It's mechanically locked. If you leave it alone, it's permanent. But yet for maintenance, you can take it off and reuse it. which makes it unique.
Right. And that, Jenny, if you want to bring up the third video and, or sorry, the last one on there, and then let's talk about, we already did the radio, or is it the RadioLock Bulb? Is that the one?
That's taking the technology and putting it into the head of a threaded bolt. So now
Okay.
you have a locking bolt that threads into a substrate. So you have the same spring mechanism, the arms that attach to the head of the bolt, teeth at the base. We got rid of the flats on the bolt.
Mm-hmm.
And we have the washer, no longer has the flats, does have the circumferential teeth. And to constrain the washer in rotation, we put either axial or radial tabs that go into pre-drilled holes. So now the washer is constrained by going in by those tabs. And when a 6-point socket is applied to the head of the bolt, it again flexes the arms inward to disengage the teeth so that the bolt is free spinning until you remove it, teeth engage, it's locked.
Okay. Now, when you, just take you back to when you first came up with the ideas, as you said, necessity is the mother of invention. You did not set out to become an inventor and start changing industries. Had you found a solution, you never would have come up with the Minuteman. You would have just started using it in your practice and saved time in conducting the surgeries. So, I mean, that would have been the end of it, but you didn't find it, and that's what had you kind of experimenting, not necessarily for initially just to create a solution for yourself.
Correct. And you know, the solution worked well, and we did get FDA approval, and we've been out in the U.S. for a number of years. But you know, the solution also provided for something new for industry. And you know, I feel that we certainly have gotten a number of accomplishments. You know, last year we were a winner at one of NASA's competition. At the same time, we won a Shell oil competition. Recently, we were notified that we are one of 3 finalists as Oil and Gas Startup of the Year at the Abu Dhabi International Petroleum meeting, which is the largest oil and gas meeting in the world. And then AFWorks, which is a division of the Air Force and Space Force, had challenges for space that they published. They had 809 companies of all sizes. And when I say all sizes, Verizon put in a solution, Lockheed Martin put in a solution. So out of 809, they down selected to 170 and had a virtual showcase or trade show. And from there, they down selected to 26 to move forward for potential contracting. We're one of the 26. So, you know, we've had a number of accolades over the last year. But like I said, I'm always Dr. Harold Hess, or just simply Harold Hess, not Harold Hess, MD.
That's right. So when you go to Abu Dhabi, it could be mistaken for an oil and gas PhD. Right?
Exactly.
In that area.
Exactly.
So I want to turn to patents, because tell me about your first patent that you proceeded with and acquired, and then how did you realize the importance of patents and start pursuing them aggressively for your innovations? And were they, and how did you expand beyond spinal surgery to get the patents to be written in a way that covers other aspects of where your idea can be used?
Right, and it becomes a little tricky because when you have 2 companies with different investors in each company, you have to keep the IP portfolio separate. I think our first patent was on a design that preceded the Minuteman. And then we modified that design a few times, eventually came up with the Minuteman, had progressive filings of patent applications. And then originally I filed a provisional on the locking mechanism. And what I did is I license it back to the spine company at a one-time nominal rate. So it's just one fee, and then they could use it forever for the applications of the Minuteman. But for other applications, such as in industry, the IP was kept separate and put into Enduralock. And then what we did as well is we took the approach in the spine company of looking at where major companies did their filings internationally. So we looked at Medtronic, DePuy, for example, Zimmer. Where do they file? And so we followed their lead. And
So
typically,
when you say where did they file, like specifically which countries, right?
correct.
That's kind of a shortcut to figuring out where could the market for this technology be. You can try to do your research yourself and figure it out, or it's public information, the actual patent filings, and figure out where the leaders are filing.
Exactly. So we took that as a shortcut, and we started filing in a number of countries. And then gradually over the years, the filings just have multiplied. And then with Enduralock, with each new design that we invented, we filed. And typically we filed then a PCT, and then converted the PCT into the national phase for countries we wanted to file in. So one unique thing about aerospace is that I know that there is always the chance of let's say a product being knocked off from another country, and then let's say China, for example, and then being brought into the U.S. But the difference in aerospace is that if a plane flies over North America or Europe, if the manufacturer of the plane knowingly uses a counterfeit product, I could seize the plane. So it is a protection, at least in aerospace, that they're going to use legitimate products. Another thing we did.
Yeah, wow, amazing. Because patents prevent competitors from making, using, or selling a product within a certain geographic area, but the airspace is within a country's geographic area. So wow. So that doesn't, right. So it doesn't matter. A product made in China and sold somewhere else, if it travels through U.S. airspace, then the U.S. patent would, of course, cover infringement.
Exactly. Yeah. So, we currently, with Enduralock, for example, we have 12 U.S. patents issued, 2 European patents, a Canadian patent, and we're patent pending on over 20 others. With Spinal Simplicity, my spine company, I think they're somewhere north of 80 patents, 80 or 90 worldwide. So it helps protect you, as you well know, to have as many fences, so to speak, as you can in the ground.
Right. I mean, it's funny. I have this iPhone here, and obviously everyone knows, now Apple's on the iPhone 12, but the iPhone has 49 patents on it, and they didn't file all 49 right at the beginning. As a product or idea evolves, as long as you have one application pending, as you know, you can file continuation applications and continuations in parts. And you use the term patent portfolio. It's you're a sophisticated inventor who understands that term. Sometimes it's referred to as a patent web, and it's the same thing. You essentially create so many patents covering your technology that a competitor would look at that and have their patent attorneys evaluate it and come back to them and say, you know what, it's just too hard to figure out where the open spaces are. You're better off licensing the idea or purchasing rights or just avoiding the field altogether. And that's how you get the real value. So I guess my numbers were off when I said 60. Well, I said 60 plus patents, but you mentioned 80 on.
Well, to be very honest, I lose track with some of the internationals. So that's why I typically say I'm somewhere north of 60. I mean, I know how many I have in the U.S. In the U.S., right. I'm named in 32 as of right now that are issued. And then the rest are, in various other jurisdictions around the world.
Right. And lots of them still, of course, pending, that they're not granted yet, and they're just kind of under the radar.
Right. I mean, certainly somewhere north of 30 that have already been granted internationally, and then probably another 30 or so that are pending.
Okay, terrific. Just one final question, because I know these days everybody is zoomed out. So when I promise my viewers 30 minutes, it's 30 minutes now. But what final piece of advice would you have for an inventor who's looking at a new idea? Something you wish, maybe something you wish you knew back when you started, or wish that somebody would have told you before, when you started.
Well, I mean, I think the main thing is just have perseverance. I mean, I've been told by a good friend of mine that my spine company was like a phoenix that would die and then and be reborn.
Right.
Because I mean, you go through ups and downs and so forth. I mean, you can imagine, for example, when the virus hit, Enduralock initially was focused really on just aerospace and oil and gas. Well, aerospace tanked, and
Right.
so did oil and gas.
Mhm.
So, I mean, you have to survive. So, then focusing more on defense, for example, or space, where they really have not been affected by the virus. So you just have to pivot as you need to. And, it's not that aerospace will never come back. It certainly will. So it's not like we lost business, but it's just been
Right.
postponed. And the same is true of oil and gas. And then continue to look internationally. I mean, I just had a really good second meeting virtually 2 weeks ago with Airbus, with procurement and their engineering team for next platform. So again, don't limit yourself just to US.
Right. And that's great advice. I mean, for the inventors that are kind of new to the process, it may be intimidating because for them, gosh, just US protection is hard to get, and there's a lot of deadlines and you have to move quickly. But one thing that Dr. Hess mentioned is the PCT. And the PCT is it's an international treaty, the Patent Cooperation Treaty, that once you file in the United States, you have a grace period of 1 year to file international applications. So I'm just letting, for the viewers who are kind of new to this, they're like, oh my God, it's not only do I have to worry about the United States, but now I have to file in China, Japan, you mentioned Canada, and a bunch of other countries. The good news is you do have some breathing room before you pursue that. And I have, this is the first time, I mean, it seems like it's just so natural. This is the first time I've heard of that strategy of looking at competitors or the big players in the industry, because if you're not sure where to file, well, obviously look at the industry that your idea relates to and look at what where the industry leaders are filing, because they have the resources to do the R&D and the research and the market research, and they hire McKinsey and consultants and they figure out where to file. Well, if they're in your industry, they've done the heavy work for you. You know which countries are going to have the greatest potential. So thank you, Dr. Hess. This has been amazing. It's an honor to have you on Ask the Patent Professor. And I look forward to us hopefully having you back.
All right. Well, thank you very much. You have a great day and a great weekend.
Perfect. Thanks.
Right.